And now all this is said is I'm, your listeners probably think like I'm a really political person now. I try not to be, I'm
Sure.
fairly apolitical, or I try to be, um, because it just doesn't serve me to get too caught up in some of the tirades. But I will say, like, when our patients encounter this, and they do encounter it, and then you have side questions asked. So, doing surgery in some places,
Yes, I
you
imagine.
will get a lot of kind of passive aggressive, microaggression type of questions that, again, would just never be asked of a cancer patient because it
Right.
would it would be inappropriate. But in this realm, you see it almost routinely. Uh, so, as a provider of something that I didn't necessarily set out to crusade on, but I'm happy to participate in care that gets people that keep telling me they are better, they're feeling better about themselves. I'm happy to do so. Yeah, it's a conundrum though, and I think it's one that's not just faced by our office, or not just faced by some of these patients who've had tremendous journeys and struggles they can tell you all kinds of things about, but also society overall. And those are conversations really that happen way over my head. And I think they're going to be ongoing because I don't think this is going away. I think this is something that, if it's really embraced, has multiple next levels that it can go to. Or if it's not, then that's also a decision that's going to be made by people, way way bigger than me. But yeah, it's interesting. It's interesting to just be, I guess, part of such a dynamic and evolving and somewhat thought-provoking process with people.
Absolutely. You're at the forefront of this. You're pioneering, and I'm going to just say, I'm on behalf of anybody with gender dysphoria, any of your patients that have successfully and cheerfully had their outcomes. Thank you. I mean, thank you for having the courage to do that and being a refuge for clients who need this type of care. So you're a pioneer, and your courage is admirable. So that's for me.
Well, thanks, Earl, but I don't know if I don't know if I deserve all that, but yeah, we all
I'm gonna give it to you because I think you do.